Good afternoon and welcome those who are joining. We're just giving everybody a few minutes to get into the room. There's quite a few of us today. All right, we have just about everyone in the room, so we're going to go ahead and get started this afternoon or morning for some of us. Thank you so much for joining the annual WIC webinar with Vaccinate Your Family, USDA, National WIC Association, and CDC. It is a pleasure to be speaking to all of you today. We've got quite a crowd, but we will leave time for Q&A at the end. So if you have questions as we go through the presentations, feel free to drop them in the Q&A box, and we'll make sure that those are addressed throughout at the end of the session. All right, just a reminder, this is being recorded, and we will be sharing this via the Vaccinate Your Family YouTube channel. So no worries if we talk a little bit fast, there's a lot of information. You will be able to view all of the information in this webinar again at your leisure and or to share with your colleagues. So before we get started with our speakers, I did want to share a quick poll question, which we'll be placing up on the screen. Get a little bit of an understanding from each of you on your views of vaccines. So each of these questions are on a scale of 1 to 5, 1 being not at all important, 5 being extremely important. And the first is, how important do you think it is to vaccinate children against diseases such as measles and polio? And if you scroll down, we have a second question. How important do you think it is to vaccinate children against COVID? How important do you think it is to vaccinate pregnant people against COVID? And finally, how confident do you feel in your ability to talk to clients about vaccines? And I will be quiet as you all have a chance to read and answer those. And this is amazing, guys. I really appreciate your participation. These numbers are just going wild on the back end. All right, so I think we're going to go ahead and close that poll up. Thank you so much for those who were able to answer. We're going to get started on our presentation. So my name is Erica Dewald. I'm the Chief Communication Officer at Vaccinate Your Family, and I'll be hosting, emceeing through your speakers today. To start us off, we have greetings from USDA. I'm pleased to welcome Kristen Garcia, the Food and Safety and Nutrition Director for WIC programs at USDA. Kristen?
All right. Hello, everyone, and thank you so much for joining us today. We're really grateful to Vaccinate Your Family for their partnership, and Dr. Sarah Meyer, Chief Medical Officer of CDC's Immunization Services Division, for presenting this webinar to update all of us in WIC about immunizations. Educating WIC participants about the importance of immunizations and providing referrals to immunization services has been a part of the program since its inception. And WIC staff, as you know, connect with participants and their parents, caregivers, siblings, and other friends and family, which uniquely positions the program to amplify and disseminate information about why immunization is so critical in ensuring the health of individuals and communities. Parents and caregivers are encouraged to bring their child participants' immunization card to WIC appointments so that WIC staff can screen the record as part of the WIC certification process and provide a referral as appropriate. As a result of these efforts, your efforts, really the community's efforts in WIC, WIC childhood immunization rates have greatly improved. Today's webinar will bring us up to date on the latest information on vaccines for our WIC participants and will be helpful in raising awareness and answering questions that you may receive from participants and their families. We can also use the information to encourage our own families and friends and neighbors to vaccinate. The number of you who registered for today's webinar certainly demonstrates the interest in this subject. I think just before the start, we were over 1,000 people registered. So thank you so much for participating. And following today's webinar, I encourage you to visit the WICWorks resource system at wicworks.fns.usda.gov, where you can access education materials and immunization resources for WIC, including the CDC's immunization schedule for children. Thank you again so much for joining us today, and I hope you enjoy the webinar.
Thank you so much. And next, I want to introduce Darlena Birch, the Senior Manager of Public Health Nutrition, National WIC Association. Thank you.
Good afternoon. My name is Darlena Birch, Senior Manager of Public Health Nutrition at the National WIC Association. It's my honor to welcome everyone to this important webinar discussing the vital role that vaccinations play in ensuring the health and well-being of the public. As the premier public health nutrition program, WIC is instrumental in not only providing nutrition education, breastfeeding support, and supplemental foods to participants, but WIC also provides referrals to health and social services, including vaccination referrals. Given that access to vaccinations are an essential aspect of public health, WIC staff play an important role in making sure participants are aware of their own vaccination needs. Not only do vaccinations improve the health of the program participants and the public at large, but they also reduce health equity issues. As the nonprofit voice of the 12,000 public health nutrition service provider agencies and the over 6.3 million mothers, babies, and young children served by the Special Supplemental Nutrition Program for women and infants and children, NWA provides education, guidance, and support to WIC staff and drives innovation and advocacy to strengthen WIC as we work towards a nation of healthier families. NWA values our partnership with Vaccinate Your Family and USDA's Food and Nutrition Service on this important issue.
Thank you so much. Really appreciate you joining us in those comments. As you all know, I don't need to tell you this, you are trusted messengers with your clients. And so we are very pleased to be able to bring Dr. Sarah Meyer, who is Chief Medical Officer of the Immunization Services Division at CDC, to bring you the latest information on vaccines and what you need to know for your clients going into this fall season. Dr. Meyer. You're on mute, apologies.
I'm sorry about that. Thank you so much for having me here today. I'm really excited to be able to come today and share with you some latest immunization updates. So I'm going to try to share my screen. All right. Can you see my slides in presentation view?
We can, thank you.
Great, okay. All right, let's get to the next slide. There we go. So I'm going to first start by telling you a little bit about myself. So as Erica mentioned, I'm the Chief Medical Officer for Immunization Services Division at CDC. So I'm a pediatrician, but I'm also a mom. And I want to start a little bit by telling you why I vaccinate my family. First, I understand the disease risks. I think anyone on this call, whether you're a parent, a grandparent, aunt or uncle, sibling, I think for all of us, there is nothing worse than a sick child. And we all know that. When our loved one gets sick, it is the worst feeling. But I would one-up that a little bit and say there is nothing worse than having a sick child, and you could have prevented that. And that is something that motivates me to vaccinate my son. I would never want to look back and think he got sick or seriously injured or even worse because of something that I didn't do and I could have done it. So that's why I vaccinate my son. But I also know that vaccines work. We've had vaccines in this country for decades. Some of our vaccines, which I'll talk about, we're going on 70 plus years of vaccinating with that vaccine in our country. We know that vaccines work. We've seen how much disease rates have gone down over time. on this screen is an example for measles. Before we had a measles vaccine, we used to have 4 million cases a year. Now we have, around 100 or so. And so we know that vaccines have worked to keep our families safe. And I also know that vaccines are safe. As I mentioned, they've been around for a long time, and they go through a very rigorous process for safety development. And this figure here shows you the vaccine lifestyle, where we go from basic research to those preclinical studies, which is basically studies in animals. We go through various phases of human clinical trials, which I'm showing you in green. The vaccines get reviewed by FDA. The vaccines get reviewed by the Advisory Committee on Immunization Practices, which is the external advisory group to CDC. And then they get approved and recommended, but all through these steps, there is a safety evaluation, even while the vaccines are being developed before they've even been given to any humans. Safety is always at the forefront, and we continue to monitor safety long after the vaccines are recommended. That's why we know, for example, how safe, some of our older vaccines like DTaP and measles and polio, we know how safe they are because we have been studying them for a very long time. I also trust the process. So I described a little bit about the process in my previous slides, but there are many steps involving a lot of people to even get to the point where we have a vaccine that can get licensed. And even after licensure, there's another rigorous process that takes place to determine whether that vaccine should be recommended for use in broad populations. And by vaccinating according to this schedule, I've been able to protect my son against 15 diseases. And we'll talk a little bit more about the schedule, but these are diseases that can be very serious. They can cause children to get sick, cause children to get hospitalized. But even beyond that, you might think, oh, well, some of these, it's just a mild flu or this or that. But that can still keep kids out of school. It can keep parents out of work. It can be a huge financial burden on people. So there are many things that we can, by vaccinating according to schedule, we can prevent our families from getting very sick from diseases, but we can also make sure that they and everyone can kind of go about their lives in a healthy way. But I didn't wait till he was born to start protecting him. As I think you all know, pregnant women are recommended to get vaccines. They are recommended to get influenza vaccine, COVID vaccine, Tdap during every pregnancy to protect against pertussis. They may need other vaccines too if they're behind. So vaccinating during pregnancy is important not only to protect mom, but it's also the first step in providing protection to her baby, which is what most pregnant really worry about. They want a healthy baby, and they will do anything to get a healthy baby. Vaccinating during pregnancy is one of the first things you can do. But there is some breaking news. We have a new immunization that just got approved in the last couple of months to help protect babies from respiratory syncytial virus, or RSV. And this many of you may not have heard much about RSV before. And part of the reason for that is until now, there wasn't really much we could do to prevent it. But now we can. So what is RSV? RSV is the leading cause of hospitalization in US infants. Over 2/3 of all infants are infected by age 1 year, and nearly all by age 2. And premature infants are about 3 times as likely to be hospitalized for RSV as full-term infants. But most children who are hospitalized with RSV have no underlying health conditions. So these are, by and large, healthy babies who have to go to the hospital because of this infection. And overall, about 2 to 3% of all infants will be hospitalized for RSV. And each year in the US, children under the age of 5 years, RSV is associated with 1 to 300 deaths, up to 80,000 hospitalizations, 500,000 emergency departments visits and 1.5 million outpatient visits. And as a pediatrician, I can tell you right now, I'm not, practicing in the hospital like I used to, but for pediatricians, this is like the dreaded time of year. We call it RSV season. Most of your hospitalizations are babies sick with RSV. And for me, it's just amazing to think how far we've come and that we can prevent much of this serious disease. So as I mentioned, RSV, there is a seasonality with RSV. It's in general, a fall and winter virus. What I'm showing here in this figure is, during the pandemic years of, we've got the 2018, 2019, 19 to 20, 20 to 21 shown here. We didn't see much RSV because people were staying home, kids weren't going to daycare. We saw that with flu, we saw that with some other things because of the measures we were putting into place for COVID. But now, so in 2023, 22 to 23, which is last season, which is in green, that big spike, we're seeing that RSV has come back, and it's coming back a little bit earlier than we anticipated. So we know that we need to be ready for RSV season this year. And, CDC actually just released a health advisory notice yesterday for providers to let them know that the RSV season has already started, especially in the southern states. We're starting to see an uptick in activity. So we know this is coming, and we need to do whatever we can to prevent it. So that's where this new immunization, or nirsevimab, the brand name is called Beyfortus, that's where this comes in to protect babies against RSV. So nirsevimab is a monoclonal antibody product. It's a little bit different than a traditional vaccine. With other vaccines, when you give the vaccine, it causes the baby's immune system to develop antibodies, which protects against the disease. With nirsevimab, we're skipping that step of stimulating the immune system, and we're just giving the antibodies to babies. So it's an immunization, it's like a vaccine, it works slightly differently, but the end result is the same, that baby now has antibodies which protect it against the infection. And in the clinical trials, nirsevimab reduces the risk of hospitalizations and healthcare visits for RSV in infants by 80%, which is huge. 4 out of 5, it's basically a 4 out of 5 reduction. And so because of that, this product is now licensed, and CDC recommends that all infants aged less than 8 months receive nirsevimab, and some high-risk children aged 8 to 20 months are also recommended to get it. So what this means is for infants who are born during the RSV season, which is usually from October to March, so similar to what we think about for flu season. So for infants born during RSV season, we say that the recommendation is that nirsevimab be administered within the first week of life. So that could mean right in the hospital, like when they get their hepatitis B vaccine right at birth. If it's not given in the hospital, the pediatrician should give it, at their first follow-up visit, which is usually within the first few days of life. Babies have their first follow-up visit with the pediatrician. So either way, it should be given within the first week of life for those babies born between October and March. For those babies born outside of the season, so April to September approximately, the recommendation is that nirsevimab be given shortly before or right as the RSV season is starting. So, a 6-month-old baby, they should get it in October. A baby who's born in October should get it in the first week of life. But that's not where the good news ends with RSV. We also might soon have an RSV vaccine given to pregnant people that would also help protect against RSV in infants. So this is like Tdap vaccine, for example. This vaccine would be given during pregnancy to women to help prevent RSV in their babies. So this vaccine has been approved by the FDA very recently at the end of August, and ACIP, CDC's advisory committee, will be meeting later this month to discuss whether pregnant women should be recommended to get this vaccine. If they are recommended to get it, it would be given towards the later part of pregnancy, like at 32 to 36 weeks of gestation. And then we would probably see some adjusted recommendations around nirsevimab, trying to figure out, if mom got the vaccine, does baby still need nirsevimab? And some of those decisions still need to be made. But I think overall, this is really great news that for the first time ever, we are going to be able to prevent this very serious, potentially serious disease in young infants. But what about other vaccines to protect pregnant people and their young children this fall? We talked about RSV, which is one of the big, respiratory winter viruses. But of course, there's others. So we'll just kind of recap influenza vaccines. So all persons aged 6 months and older should receive an annual influenza vaccination. And this includes pregnant people during any trimester of pregnancy. So if a mom is pregnant during flu season, she should get vaccinated. That will protect both her as well as her baby. And that's because both pregnant people as well as infants aged less than 6 months of age, so those infants too young to get vaccinated themselves, are at increased risk for hospitalization with influenza. And influenza vaccination during pregnancy has been associated with a reduction in influenza-associated illness by about 40% in moms and about 72% in babies aged less than 6 months. So this vaccine is very helpful to prevent disease both in mom and her baby. So influenza vaccine should ideally be offered in September or October. We usually say no later than Halloween is when people should have gotten their flu shot by, and continue through the flu season. So there are a few people that can get it earlier than that. Children who require 2 doses because for the first season, if a child has never gotten flu shot before, they're recommended to get 2 doses that year and then 1 dose every year after. And then pregnant women in the 3rd trimester. But of course, we've already passed July and August. We're now in September, but just for awareness, there are some groups who can get it earlier. And then COVID-19 vaccine. So similar to flu, everyone ages 6 months and older should stay up to date with their COVID-19 vaccines. And this includes people who are pregnant during any trimester of pregnancy. And this is also because COVID-19 disease can cause serious disease in pregnant women and their infants. And COVID-19 disease during pregnancy is associated with severe maternal health outcomes and adverse pregnancy outcomes. So what does that mean? As I mentioned in one of my earlier slides, if you ask any pregnant women, what they care about most is, the health of their baby. They will do anything to protect their baby's health. And one thing that a lot of people don't realize is that if you get COVID-19 during pregnancy, it increases your chance of miscarriage. It increases your chances of having a stillbirth baby. It increases your chances of having a preterm delivery. It increases your chances of that baby having to go to the intensive care unit. So getting COVID, the disease during pregnancy, is actually not only can it affect the mom's health, because those women can have more serious health outcomes that, they can, the disease is more serious in pregnant women, but it can actually threaten the pregnancy. So that is one reason why we say, all women should get, pregnant women should get the vaccine to protect themselves, but also to protect their babies. And then also infants aged less than 6 months are at increased risk of hospitalization due to COVID. So these babies are too young to be vaccinated themselves. And amongst children, they actually have the highest risk of hospitalization. So preventing that through vaccination is very important. And what we've seen in our most recent set of data, which is basically last fall and winter's data, is that the COVID-19 vaccine was about 61% effective in preventing pregnant women from having to go to the ER or urgent care due to COVID-19. It was about 56% effective against preventing hospitalization among infants aged less than 3 months, and about 38% effective in preventing hospitalization in infants less than 6 months. So very important that people stay up to date on their COVID-19 vaccines to protect themselves during pregnancy as well as protect their baby. And then we also talk about Tdap vaccines for pregnant people. And this vaccine is recommended for pregnant people because pertussis or whooping cough can be a very dangerous respiratory infection for young infants. So those, in the first few months of life, especially. So a dose of Tdap vaccine is recommended during each pregnancy, preferably in the early part of gestational weeks 27 through 36. So just to recap, if RSV vaccine were recommended, that's given a little bit later. Tdap is in general given a little bit earlier, and flu and COVID should be given during the season, regardless of where they're at in their gestational weeks. And we've seen that Tdap vaccination of pregnant people is about 70 to 90% effective at preventing infant pertussis, which is kind of what I'm showing in the figure on the right, that as vaccine coverage goes up, which are the bars, kind of blue bars, the rates of pertussis in infants aged less than 2 months, so those newborns, has been going down. So just a few reminders about all of these vaccines that I've talked about so far. Vaccination helps prevent you from getting sick, but no vaccine is 100% effective. But even if you do get sick, let's say you get the flu shot and you still get the flu at some point, your illness is going to be milder. You're at less risk of having to need to go to the doctor, having to go to the hospital. You can get back on your feet sooner. You might miss less work. So it's still very important to get vaccinated. But you cannot get the disease from the vaccine. So you cannot get the flu from the flu shot. And then vaccination during pregnancy protects babies who are too young to be vaccinated themselves, in addition to protecting mom. But fall is also the time for routine vaccine catch-up, because this is, we're in the period where young children are heading back to school and daycare. So I focused, a little bit earlier on all these respiratory viruses that are coming up this fall and winter, but there are other vaccines that we need to make sure, especially our children, are caught up on, because this is also that kind of critical back to school period as well. We have seen some effects of the COVID-19 pandemic on routine childhood vaccination, but it's a little bit of a mixed picture. So for our vaccine coverage in 2-year-olds, where we look at kind of, we look at this metric called the combined 7 vaccine series. So it's a group of vaccines that children should have gotten by 2 years of age. And if we look at that, we see that it's about 4 to 5% lower post-pandemic compared to pre-pandemic for those 2-year-olds living in below poverty or in rural areas. So these are a lot of the children that you serve with your clients. They've had about a 5% drop in their vaccination coverage. Overall, among all children, 2 years of age, we didn't see that big of a decline, but it's these 2-year-olds living below poverty or in rural areas that we're seeing the biggest declines. And that is very concerning, because we really need to make sure these kids are able to get caught up to date. We've also seen about a 2% decline in kindergarten vaccination coverage. So these kids who are on their way to school, and 2% may not sound like that much to people, but when you think about how many children that actually means, just because of how big our country is, these are hundreds of thousands of children that are not protected when they go to school. And we know that, if, in schools, infections can spread pretty quickly. So that's why it's really important to make sure our school-age children, so those kids who are headed off to kindergarten soon, that they get caught up to date too. I'm talking about these declines, but we have seen some positive signs too. Like I mentioned, overall coverage is high among young children, and most children have received their recommended vaccines, but it's really these other groups that we want to make sure can get caught up too. All right, so let's talk about the schedule a little bit more. I know this can be overwhelming to look at, but if you kind of, I want to help us focus on a few vaccines to pay attention to as we talk about school catch up. And just at a big picture, As I mentioned earlier, by vaccinating against this schedule, we can protect against 15 diseases. So this is a resource that you can pull up. The link is at the bottom. This is something that you can show to parents, but you can, if you see a child in your clinic, let's say, 18 months of age, you can quickly go down the list and make sure, have they gotten their vaccines? And if they haven't, refer them to their pediatrician or somewhere else to get them. Even if you're not sure, I don't know, I don't have all their records, I only have some of their records. If it seems like something is missing, let them know, because sometimes parents just don't know. Nobody told them. They haven't been to the doctor in a while. They just weren't aware. So even if you're not sure, refer them somewhere so that, a healthcare provider can go through more thoroughly, make sure they have all the records and get them caught up. So let's talk a little bit more about measles, mumps, and rubella vaccine, or MMR. So measles is a highly contagious virus that spreads through the air, and it can cause serious health complications, especially in children younger than 5 years. And 1 in 5 people with measles are hospitalized because of their infection, and 1 out of every 1,000 people can develop brain swelling, which can lead to brain damage. And 1 to 3 out of 1,000 people who get infected can die. So it's really a very serious disease, but it's also, one of the most contagious. I think we have some data that says if somebody gets measles and they go into a room, they can infect 9 out of 10 people in that room if those people aren't protected through vaccination. So it's one of those diseases that spreads through the air, and it is very contagious. And so that's why it's very important. We can't let anyone slip through the cracks in their measles vaccination, because if there's measles somewhere out there in that community, it will find those unvaccinated people. That's because it's so contagious. So measles has been reported in almost all US states in the past 20 years or so. So some people think, oh, well, I haven't heard about any measles in my community. I don't need to worry about that. Or that's only in big cities or something like that, but that's only in certain communities where people are, maybe traveling or immigrating or that kind of thing. But I think the point here is that measles has been reported across the US in all types of communities. Measles, mumps, and rubella, or MMR vaccine, is safe and provides long-lasting protection. So I kind of mentioned this in my intro, but MMR is one of those vaccines that's been around for a long time in the US. It's been around for over 50 years. We have used this vaccine. People, our parents, my parents' generation, have been getting that. Like it's something that has been around a long time. So we know that it's a safe vaccine. MMR is a weakened attenuated live virus vaccine. So this means it's a weakened form of the virus, so it cannot cause measles, mumps, or rubella. It is highly effective. Depending on number of doses, it's about 93 to 97% effective in preventing measles. And we recommend 2 doses of the vaccine. First dose at 12 to 15 months of age, and the second dose at 4 to 6 years of age. Next, I'll talk a little bit about polio. And, polio, the reason I'm bringing up polio is because this is one of those diseases that people say, we don't have polio in the US anymore. We can stop vaccinating. Everybody else is getting vaccinated. I don't need to get my child vaccinated because I haven't heard of anybody getting polio. Polio is a life-threatening disease and can infect a person's spinal cord, causing permanent paralysis. But it's not necessarily true that, we don't have this disease anymore. We saw a case of paralytic polio in the US for the first time in decades, and this happened last year. So again, this is one of those diseases where, it's still out there in the world. We live in a very connected world now. People need to continue to be vaccinated because it can find its way to us, and, having your child, or this even can affect adults who are not vaccinated, can cause permanent paralysis. And again, polio vaccines have been around for a long time. The first polio vaccines were licensed in the US nearly 70 years ago, and since the late 80s we've been using a form of the vaccine that's called inactivated polio vaccine, or IPV. It's the injectable form of the vaccine. It is, it cannot give anybody polio virus. So that's what we've been using since the late 80s. And again, this is an extremely effective vaccine, about 99% effectiveness after 3 doses. And children get 4 doses of the inactivated poliovirus vaccine. So why is on-time immunization so important? Some people might say, okay, well, I'll get my child vaccinated, but I'm going to wait, or I'm going to space them out. So they're not people that are refusing to get vaccinated. They just don't want to get them on time or all together. So why do we need to give them on time? Vaccines help provide immunity against potentially life-threatening diseases. So the sooner we get kids and everyone who's recommended to get vaccinated, the sooner we get people vaccinated according to the schedule, the sooner they will be protected against these various serious diseases. Also, the vaccine schedule has been carefully designed based on all of the safety and effectiveness data that was generated as part of clinical trials. So giving the vaccine according to a specific schedule is something we have tested. It's something that was reviewed as part of the development process. We licensed and recommended those vaccines based on the schedule because we showed that that schedule was safe and effective. So deviating from the schedule, we haven't tested any schedule that, was different from the one that is published. And also, on-time immunization is also just tied to on-time well child visits. So it's not just vaccines that happen at these visits. It's a whole host of other services that are important for the child. That includes tracking growth and developmental milestones, discussing any concerns about the child's health, as well as getting scheduled vaccinations to prevent illness and diseases. So CDC has recently launched an initiative called Let's Rise, or routine immunizations on schedule for everyone. And there are, some links here that takes you to our page, which has a whole host of resources, kind of like a toolkit compiled that, helps, to provide resources to help people get back on track with immunizations, get caught up on any vaccines that may have missed. I also wanted to mention a little bit about cost, because you may get questions about this. Your pregnant moms or their, with their children might say, well, I can't afford this. I can't afford to go. But there are many options for getting vaccines at no cost. So for pregnant women, in general, they should already be covered for these vaccines. But just to emphasize that starting October, there's actually a new law, is the Inflation Reduction Act. So it was passed by Congress. And in this new law, Medicaid is, it basically says Medicaid will cover all ACIP recommended vaccines in adults at no cost. So it won't depend on the state Medicaid regulations or anything like that. This will be across the board. Medicaid will cover these vaccines, and pregnant women are eligible for Medicaid. So this is going to be great for making sure that no pregnant women fall through the cracks. For children, we have the Vaccines for Children, or VFC program, which provides vaccines at no cost for eligible children. Again, this and that includes, so who's eligible? Medicaid eligible children, children who are uninsured, children who are underinsured, or American Indian or Alaska Native children. And this program, the VFC program, actually provides about half of the vaccines in the US for children. So about half of children are able to access the vaccines through this program. So it's not anything that the parent has to enroll in per se. They just have to, when they're talking to the provider, they just have to say, they don't even have to actually prove anything. If they can't afford to pay, then they are part of the program. And most pediatricians in this country are part of the VFC program. So it's actually not challenging to get vaccines through this program for children. So what can you do to help? As mentioned before, review your client's immunization records and make referrals when needed. Also provide a strong recommendation for vaccination. Your clients trust you. I think Erica also mentioned that front. They're looking for information from people that they trust, and you are definitely one of those people. So letting them know that you support vaccinations, you think it's important for them, for their children. I would also say start the conversations early. If you have a pregnant mom, it's not too early to start not only talk about vaccines for themselves, but also start talking about the vaccines for their babies, because we've done surveys, most pregnant people actually make vaccines decisions for their child before or during pregnancy. So while they're pregnant, they may already start deciding if they're going to get their child vaccinated as children. So starting these conversations early, especially with your pregnant patients, is very helpful. It's also helpful to tell them what to expect. It's always helpful when people aren't hearing something for the first time. So this could look something like, when your baby is born, she'll get her first vaccine in the hospital to protect against hepatitis B. You could also add in here, and RSV, because that's a new one. So that when the baby's in the hospital, the mom isn't like, taken off guard that there's a vaccine that's recommended to her newborn. Or when you go to your prenatal visits, you'll get your Tdap vaccine. That, again, that primes them, lets them start thinking about that so that they're more ready to kind of accept the vaccine when they go to their healthcare provider. And then share any information and resources on vaccines and answer their questions. But finally, vaccinate your family and tell your clients why they should too. I started off this talk with my story of why I vaccinate my family. People want to hear, they want to know what you're doing. They want to hear that you trust the vaccines enough to vaccinate your own children. That gives them peace of mind that it's the right decision for them. And if you have any questions about vaccines for yourself, your children, your family members, make sure you get your own questions answered by your healthcare providers or someone that you trust, because the first step is getting that information for yourself, protecting your own family, so that then you can serve as a resource to the families that you serve. And then I won't go through these in detail, but there are numerous resources available on our website. I think you'll be getting these slides, so providing these for reference as well. All right, thank you.
Wonderful. Thank you so much, Dr. Meyer. That was a lot of really great information. And as we mentioned at the top of the call, we will be sharing this recording on our YouTube channel. So don't worry if you didn't absorb it all. We will definitely put that up so you can look at it again. We've been getting some really great questions in the chat box while you were speaking. So just wanted to start off with a general one. You mentioned the importance of following the recommended schedule and how carefully that's tested. But can you talk a little bit more about how you might answer a parent's concern that their child's getting too many vaccines too soon? Is there an official alternative schedule?
Yeah, thanks for that question. I mean, I think how I would answer it is, I would start by describing, there's a reason why we vaccinate our children according to that schedule. As mentioned, it is what we have tested. We know that it works. We know that it's safe. We know that if we delay any of those vaccines, we will only prolong the period for which that child is at risk for diseases. But what I will also say is, children, newborns, they are exposed. They are coming out into this world, and they are exposed to so many things. They are exposed to viruses. They are exposed to bacteria. They are exposed to so many things, and it is so new for them. But newborns, their immune system is, in every stage of life, our immune system adapts. Our immune system as a baby is different from our immune system as a child, is different from our immune system as an older adult. But through each of those, our immune system adapts, and they have come into this world ready to adapt, and they are being exposed to viruses, bacteria, etc. So giving them a vaccine is not some crazy exposure that they are being exposed to things. So that vaccination actually helps protect them, it helps their immune system respond through vaccination instead of responding to just this haywire of germs that they're being exposed to. So I guess the point being, the baby's immune system is able to handle this. They are exposed to many things on a daily basis, but this is one thing that helps prevent them from getting sick, rather than have their immune system respond to the actual germ and them getting sick. Hopefully that helps.
Thank you. Yes, as a parent myself, there's nothing worse than a sick baby. Nothing. So appreciate that. I want to turn specifically to COVID-19, right? There's still lots of questions about the COVID-19 vaccine, particularly for pregnant people and children under 5. Full disclosure, I have a 7-year-old and a 5-year-old. They are both fully vaccinated according to the recommended schedule, and they've gotten all their COVID vaccines. But what can we expect for the COVID vaccine moving forward? You mentioned, there's a new recommendation coming. How can we encourage people who might say, been there, done that, I've gotten COVID vaccines, I'm not getting another one?
Yeah, I know, great question. I think, so the meeting, there is a meeting next week with the ACIP. So we will have new recommendations as of next week, we anticipate. I think what we, are most likely anticipating is similar to our current recommendations. For most people will, just be recommended to get a dose. So if you've, regardless of if you've gotten 1 dose, 2 doses, 3 doses, no doses, right now you've been encouraged to get the bivalent vaccine to stay up to date. I think we can expect to see similar recommendations that for most people, regardless of what you've gotten, get your dose. For children, right now, what's currently recommended is, multiple doses as like a primary series. So 2 or 3 doses, depending on the manufacturer. And the reason for that is that in younger children, it can take a few doses to reach that level of immunity necessary to protect. So for children, I think we can anticipate, still them needing a few doses while they're young before, they move into just, an annual dose or something like that. There was a second part of the question. Now I'm trying to remember what it was. If you've already gotten it. Yeah, if you've already gotten it. So what I would say to that is, of course, we have to see what the recommendations are next week. This was kind of reiterating what the current recommendations are. So that's, if nothing changed, that's how they would go with an updated vaccine. But we will certainly have more information next week. But what I would say about if you've gotten vaccinated in the past or gotten COVID in the past, at this point, many people have got COVID or they've been vaccinated. But that immunity does not last forever. We know that immunity wears off. And, if the last vaccine that was received was, last fall or last winter or something like that, we would need another dose to, bump up that immunity to protect for this fall. So it's great that people have gotten vaccinated in the past, or even if they've gotten infected in the past, they have some level of immunity, but we need to keep up to date to maintain that immunity.
Thank you. So important. And everyone stay tuned, cdc.gov, vaccinateyourfamily.org. We will definitely get the information to you as soon as possible when we have those updated COVID-19 vaccine recommendations. Okay, last question for you. We've all heard it. I got the flu vaccine and then I got the flu. Or some somewhat serious feeling side effects from the COVID-19 vaccine, right? Not just pain at the injection site, but fever, et cetera. How do you talk to somebody about getting a vaccine when they have had a poor experience with a previous vaccine?
Yeah, I think in terms of, I got the flu vaccine and now I got the flu. I know that it is clearly to most people, the logical, oh, well, I got it from the flu vaccine. But we know with 100% certainty, there is no biologic way to get the flu virus from the flu vaccine. It is not that is not how the vaccine works. What I would say is, as I mentioned, no vaccine is 100%. There are going to be people who get the flu vaccine who still get flu. They would have gotten it anyway. They would have gotten flu virus anyway. But what the flu vaccine does is help to reduce the severity. So potentially instead of being in bed for days or maybe having to go to the ER with the flu, if you've been vaccinated, you're more likely to have more of a milder case where you're down for a little bit, but not too sick. So the flu vaccine can help you get, more seriously ill. But if you get the flu after the flu vaccine, it is not from the vaccine. It's, it's just that the flu vaccine, like no vaccines are 100%. I think in terms of just general side effects, talking things about sore arm, redness, kind of feel that achy thing after the vaccine. I know it's unpleasant and people don't like it, but it is, when you get that, for example, when I get that, I'm like, oh, good, my vaccine is working. My immune system is working. This is going to protect me. And there are things you can take, ibuprofen, acetaminophen, those types of pain relievers do help. So you can help to treat the symptoms, but those are very temporary. Usually they last just a day or so. They don't cause any long-term side effects. They're a very small price to pay to, help protect against more serious illnesses that you could get if you're not vaccinated, which can cause a lot worse than just kind of a sore arm.
Awesome. Thank you so much. Such important information. I know we have more questions, but we will get those answered in the Q&A box because I know Dr. Meyer needs to move to yet another call. But thank you so much for your time. Really appreciate it and looking forward to continuing the conversation.
Thank you so much.
Thank you. So folks, we have just one more poll that we want to provide to you to get your thoughts on how some of your perceptions may have changed over the course of this webinar. So we're going to throw up those poll results. And we have corrected the final question, as many of you noted. We still had not all at all important versus confident. So that has been changed. But go ahead and take just a few minutes to answer these questions again. Again, from a scale of 1 to 5, 1 being not at all important or not at all confident, all the way to 5, extremely important, extremely confident. Let us know what you think about the importance of getting kids vaccinated, pregnant people vaccinated, and then your confidence in speaking with your clients moving forward. Incredible. So we'll close that poll in just a couple more seconds. I don't want to cut anyone off if you're in the middle of answering those questions, but I want to take these last couple of minutes to thank you all for your time, not only today, but every day and all of the work you do for your clients to keep everyone healthy, fed, and safe. Please keep yourselves safe as well. As Dr. Meyer said, if you have any questions about vaccines, please feel free to reach out to us. We'll be sending up a follow-up note that'll include my email address. So if you had questions that weren't answered today, please don't hesitate to ask those. And we look forward to continuing this conversation. Thank you so much for your time today, everyone. Have a great rest of your day.